Let's talk about apprenticeships here a little bit first, give you an overview of them. Why is not working? Oh, there we go. Yeah. So what is an apprenticeship program? So a apprenticeship program is really it's a work and learn model. I know many of us have probably were working and gone to school at the same time, right? And that's exactly what an apprenticeship is. They're working and they're going to school. The little bit of difference is that they are going to school for the job that we are training them for, right? So they're working that job and then they're learning that job at the same time. An apprenticeship program, it really it outlines that career pathway for someone. It has a structured on-the-job training. So it lists all the components of what they're going to learn on the job. And then it also lists the courses or course that they need to take throughout that time. This is also an employer paid program. It does include a wage progression. So one who, when they start an apprenticeship program, they're going to start at a certain level. And then as they, build competencies or milestones, that wage increases. And then it increases again until they be actually finish all the on-the-job training as well as the related training instruction. It is employer paid. The employer does pay the wage and the employer does pay the education. It's not a reimbursement program. So for those of you who have reimbursement programs, I highly recommend you turn those around and you pay for the education in advance versus the reimbursement piece. And also, apprenticeships end up with industry recognized credentials. It could be an industry recognized credential. It could be an associate's degree. It could be a certificate. It could actually even be a bachelor's degree because the length of an apprenticeship is determined by you, the employer, and or the criteria that is needed to fulfill that job. Now, what's a registered versus a non-registered? A registered apprenticeship program, as we call a RAP, is registered means that it is recognized by the Department of Labor. Okay. And why do you want to have a registered apprenticeship versus a non-registered? Is because it opens up doors. It opens up doors to grant funding. The state of Illinois has large initiatives going on right now with non-traditional registered apprenticeship programs. Most people are familiar with the construction trades as a registered apprenticeship program. But the state, through DCEO, has a number of initiatives to expand the non-traditional ones, such as a community health worker. And also, if you have a registered apprenticeship program, it opens the doors to tax credits. So as I mentioned, an apprentice, the education is paid by the employer. So if an employer pays up to $3,500 for that education per year, they can get a tax credit of up to $3,500 that year. So if the education costs $2,000, they get a tax credit of $2,000. If the education was $4,000, they only get a credit of $3,500. But unless the apprentice or company is in an underserved or low income area, then that increases up to $5,000 of tax credits toward the education that an employer pays. And also, when it's a registered apprenticeship program, they receive a certificate from the Department of Labor that says that they've completed their apprenticeship program. So there's various, reasons why one would, an employer would want to have a registered apprenticeship program. Some statistics here, 90% of employment retention. Apprentices stay after completing the apprentice, 90% of them do. So obviously lowers your turnover. Average starting salary after they complete apprenticeship is about $80,000. And then as you can see, it's a lifetime, earnings of 300 plus for someone who went through an apprenticeship program versus someone who did not. And even as an employer, for every dollar you spend on a registered apprentice, there is a return of investment of $1.50. Some other benefits, you get a skilled workforce, right? You are training an individual for an occupation within your company. So you're training them, in other words, grooming them for your company. It improves productivity. We've talked about reducing turnover. Customizable training, you can, you as an employer really determine what program or what education the individual needs to meet that occupation. And then again, 90% of apprentices continue employment after completing an apprenticeship. So what are the like components and requirements of a registered apprenticeship program? So one is you need a sponsor, right? And that is the owner of the program. That can be an employer, that can be a training provider, it can be an industry association. They're the ones that provide the oversight, the compliance, the reporting, and just ensures that the quality of training is happening and that and the things are happening on the job. And then also the sponsor must enter all the information into the Department of Labor database, which is called RAPIDS. Now, um, the other component is, okay, so you have the sponsor, but you also need the employer, right? As the employer is going to do the on-the-job training. And then most apprenticeships are at least 2,000 hours per year. For most apprentices or apprenticeships, it could be 1 year, 2 year, 3 year, 4 year, 5 year. It just depends on the occupation that we're training for. For example, if you were doing a CNA or even a nurse, there are certain criteria that they need in terms of education. So that's going to extend the length of the apprentice or the apprenticeship. Now, you also need a training provider, right? And that, which provides the related training instruction. Again, okay, sorry. Did you let them in, Michelle? I saw, okay. And an apprenticeship requires 144 hours of classroom time per year. So if the apprenticeship is 1 year, it's 144 hours. If it's 2 years, it's 144 hours each year of classroom time. And then also there needs to be a wage progression. They start at a certain salary, a certain wage, and that must increase throughout the length of the apprenticeship. And then also you need a mentor and or a supervisor of the apprentice that will ensure that they are meeting the on-the-job learning components of the work. How a registered apprenticeship works. One is you need to hire or select an apprentice or an employee, right? This can be a new employee or this can be a current employee that you're looking to upskill into that occupation. The employer provides the on-the-job training. The employee completes the related instruction. Employer tracks the competencies, and the employee is then promoted to that skilled role. Now, let's talk a little bit about a community health worker apprentice, the ones that we have here at the university. So a community health worker is that frontline person, is that bridge between the community and the health or the social services system. They're a trusted member of the community that they serve. And then, and it's providing health education, coaching, it's connecting individuals to resources that they may need, helping them navigate the systems, insurance, housing, benefits, advocate for the community needs and help reduce barriers. They support individuals in managing chronic care. They conduct outreach, home visits, and follow-up care. And they just promote a health equity and address social determinants of health. And keep in mind, community health workers do not provide clinical care, but they play a vital role in just prevention, care coordination, and community well-being. So the apprenticeship program here at Governor State, where we are the sponsor, so we are the owner of the apprenticeship program. So that means we take the brunt of the work and making sure that all the paperwork is completed, and we're submitting all of that to the Department of Labor. Dr. Joe Day, who is on the call, has developed the training. The program, the classroom training will be virtual. And we're going to start with a pre-apprenticeship training first, which is just kind of a foundational training to prepare individuals to enter that apprenticeship program. And that we are looking at starting on February 23rd through March 6th. That's 10 hours. It's a 20-hour program. It'd be 10 hours each week. We're still determining the actual times of that. Um, and then after that program, March 9th and through March 27th, we will have the apprentices interviewing with companies. Now, unless you have somebody already in mind that you would like to bring on, that's perfectly fine. If you have somebody that you are already working with that you want to move into that role, that works as well. Otherwise, we will be doing a recruitment starting, I think we started this week already to recruit apprentices for this program. Um, this gives you the option to interview and hire. We're not saying you have to take this individual or that individual. This is a decision that you would make based on the interview. And then we would look to start the training on March 23rd. And that's what we said, it is a 1-year training. It's 144 hours. That will be meeting on Mondays and Wednesdays from 2 to 3:30. And then we're actually looking them to start work on March 30th. And so they will be going to school and they will be working during that entire time. As we talked about, a wage progression, we are looking, and that is determined by the employer in terms of what they want to pay. Um, but we are looking to starting the apprentices at least $20 an hour, with a completion of at least 25 per hour. It means when you hire them or they start the apprenticeship, they should be getting paid $20 an hour. And then maybe was it in 6 months, they could move to 23.50, and then when they complete after the year, they move to $25. So as you explained it, this is what employees or apprentice knows. They know what classes they need to take. They know what they need to learn on the job. They know what they're going to get paid, and so it just really makes a robust program overall. Now, the lucky part with this is that the tuition for the grant or for the education is covered by the grant. So there is no employer costs regarding the tuition for this. It is the wage that the employer must pay. There is also some other opportunities for to access grants, such as an on-the-job training grant through the Workforce Innovation and Opportunity Act, where we will connect you either to John Hall at the Workforce Services of Will County, or even to Victor at the Chicago Cook Workforce Partnership, who can talk about on-the-job training dollars that can reimburse you some of the wages that you pay them for like the first 3 months. I know that's a lot of information. It's very quick. And I'm going to stop here and see if there are any questions.
I have a quick one. Do you know what like kind of healthcare employers are typically employing a community healthcare worker? Is it typically hospitals, minute clinics, other sort of employers in that realm?
Michelle, you want to answer that?
Yeah, it can be a variety of different kinds of employers, counseling clinics, counseling
Mhm.
agencies, local advocacy agencies. For example, Pathlights could be an agency that would employ community health workers. Hospitals could employ community health workers. Many times hospitals will employ community health workers to do um, health education series or programs. So it could be really a variety of different kinds of settings that are medically facing or health concerned facing, both preventative and reactive healthcare. So a variety of different kinds of settings and uh, placements.
Yeah, cool.
Victor, you have a question?
Yes, good morning, everyone. I see that the minimum starting salary is $20 an hour. If you have an employer that for some reason the starting salary is less, let's say $19, can they participate in this apprenticeship program?
Yes, of course. This is just recommended pay because
Okay,
$19 an hour. We would still like at the end of the apprenticeship for them to be closer to that 25 when they are finished because we certainly want to make it a living wage here at the end.
understood. Thank you.
But yes, that we could. It is up to the employer as to what they're paying.
One more question. So, with the RTI portion, is it all primarily in person, virtual, hybrid? I don't know if
Classroom training is virtual. It from on Mondays and Wednesdays from 2 to 3:30.
Okay.
And also with the grant, each of the apprentices will receive a laptop as well. We do have supply chain logistics apprenticeship programs as well, so I threw that in here. We do have 3 of them. So if anyone is interested in supply chain, we're happy to talk to you about that as well. And we do have additional information sessions for anyone that has not made today, so please let others know. I'm going to go ahead and stop sharing my screen to see if there are any additional questions or thoughts. Or who's ready to bring on an apprentice?
I was just gonna say that, Craig. Don't be shy, we're all friends now.
Well, I don't want to speak for Johnny here, but of course, we 7 is very interested in providing those additional resources in the form of OJTs, or even incoming worker training to uh, those employers that are want to be part of this apprentice or the other apprenticeship programs that you have.
Victor, can you talk a little bit about that, the on-the-job training and the incumbent worker training dollars?
Sure. So the on-the-job training is a reimbursement program for those that are registered in the WIOA, the Workforce Innovation and Opportunity Act. And it varies by regions, but for the most part, it's very similar in some aspects. The total number of hours is 1,040 as a maximum for each participant. And in our region, it can be up to 6 months. So the reimbursement is typically 50% of the hourly wages. So if somebody's making $20 an hour, the employer will receive $10 back, 50% for up to 10,000. We currently don't have a cap on the number of participants an employer can hire through WIOA for OJTs. So it's a pretty good program. It is one of the most successful business service solutions that we have in our region. And regarding incoming worker training, that one is also a reimbursement program for the training that an employer will provide to those incumbent workers. For those that have been working 6 months or more in a company, can participate. And then there's nothing that prevents us from doing with the same employer an OJT and then complement that with an incoming worker training. So an employer can benefit from these 2 services, in our region. So it is pretty similar in some other areas. Right now, we are giving priorities on Cook County for incoming worker training projects. They are part of an apprenticeship, a registered apprenticeship program.
Great. Thank you for that, Victor.
Mhm.
See, so there's a lot of benefits right now to joining a registered apprenticeship program. Free
Good morning.
education. Yes. Hi, Michelle.
Hi, Hi, good morning. Victor invited me, and so just to support even what Victor shared, and what you shared too, Craig, with the employers, is just the about the on-the-job training and the income IWT, incumbent worker training. Definitely, if employers, if that caught your ear, like reimbursement dollars back to you to help you offset the cost for your employees to receive training, or even the new hires to receive training, you get reimbursement back for that. And so if you just wanted to hear a little more about that, or ask questions about that, I will put my name in the chat, and my email address, so that you can connect with me if you have, or connect through Craig and he can connect you with us. The Healthcare Sector Center, we are part of the WIOA that Craig and Victor spoke about, WIOA. And so we can really answer questions if you have them about, what's that reimbursement about? What did Victor say about that $10,000? What did he say about covering and training for our current existing employees who have worked 6 months and all so definitely great opportunities here to help you offset cost by being part of the apprenticeship. And so just wanted to offer that additional support in answering questions about reimbursements that you can get as an employer.
I'm going to share my screen again here. This document here is what they call the Appendix A, and it outlines the work processes, or the position. So this here is like what the mentor or the supervisor would go through to check off that the individual completed, perform basic diagnostic, administer immunizations, maintain updated client records. It just lit, and this can be modified, up to 25% based on what you as the employer want to do or change. And then, as you can see, it's quite lengthy. And then after that, then it goes into the education piece. So once, this is all mapped out for 2,000 hours. Those are all the things that they're going to do and learn on site. And then this here is the training instruction. 52 weeks, it's 144 hours as required. And that's the kind of the overview of the instruction.